Hi, everybody. It's Dr. Kerry Yerkew. Thank you for joining me today for this webinar based on my book called Joint Journey. And I wrote this book recently over the last 5 months, and it's now live on Amazon. We got some copies in the clinic this week, and patients have been buying the copies. And I really like the way the book turned out. I do like the cover as well as the material inside. I like that there's color illustrations in the book. I like that there's a lot of references in the book. So it's an upgrade from the last book I did, which was 2 years ago, called The 100-Day Diet. Now, this book is a progression from the books I've written. The first one I wrote was on back pain, and it was on Amazon. The next one was on neck pain, which included headaches, whiplash, and concussions. And then the 100-Day Diet was on weight loss. And then this one is combining joint health with lifestyle changes to live a healthier life. So today is the first webinar that I'm doing to get into the material of the book. It's a free webinar. It'll be about 20 to 30 minutes. If you have any questions, please type them in the chat, and I'd be happy to answer those questions for you. Also, maybe give me a thumbs up if just to make sure you can hear me okay, because I want to make sure that the volume is getting through all right. It seems like it is getting through okay. So let's get into the material, talk about Joint Journey, and talk about how this material can help you. I'm going to switch to being in the top corner of the screen now, and then I'm going to get into the material here, which is our webinar today on Joint Journey, Lifestyle Changes for Lasting Weight Loss and Joint Pain Relief. And today's webinar specifically is on unlocking health through lifestyle changes. So we want to talk about what you can do if you have joint pain, if you have arthritis, if you're overweight and you want to lose weight, take some stress off your joints. What can you do about it? That. And today's webinar is part of a series. I usually do my webinars on Saturdays, but today I'm doing it on a Friday. And I record the webinar, so the same link that you get for these webinars, you can watch the recording later. So they'll be recorded and the same link will work, which is very convenient. And often these webinars are promoted inside the clinic, but they're also promoted on Eventbrite and on social media. So you can always subscribe to my YouTube channel, like this video, but also follow me on social media and Eventbrite, because you can get tickets there on Eventbrite. So my name is Dr. Kerry Yerkew. I'm a chiropractor here in Kelowna, British Columbia, and I've been practicing for 30 years now. I've seen thousands of patients over the years with joint pain, arthritis, weight issues. It seems like the weight issues have become more prevalent over time. So it is definitely something that we want to address and talk a little bit about today, but also in the future. I'm just going to move my picture over because it looks like there's a little bit of a timestamp over my picture right now. So I'm a chiropractor. I've been practicing for 30 years. I see a lot of patients in the clinic with neck pain, back pain, joint pain, different conditions. And so I use a number of different methods to treat that in the clinic. So I write about it in the book, the different methods I use, and I'll touch on it today as well. So what we offer in the clinic is we offer a holistic approach to treat joint pain and arthritis. Our services include chiropractic care, shockwave therapy, laser, orthotics, and personalized lifestyle coaching with recommendations such as supplements, relaxation techniques, and sleep posture education. So in the book, I do talk about ways to relax your muscles, reduce inflammation, diet, and sleep habits, other lifestyle changes like exercise. I even include a psychologist who I introduce the two patients in the book to. So the two fictitious patients are Josh and Susan, and they're a kind of an average or an accumulation, consolidation, let's put it that way, of the patients I've seen over the years. So Josh and Susan represent kind of the mainstream type of patient that presents to the clinic with a number of different health issues. And then I guide them through getting relief, but also introduce them to various experts in the book that help them with making lifestyle changes and changing their habits. So in the clinic, I do chiropractic care to improve joint alignment, posture, and flexibility. And then I also use modalities like shockwave, laser, orthotics, and products. Today, I actually just did a orthotic impression here in the clinic. I used laser this morning on somebody who had a rotator cuff in their shoulder. I use shockwave for a number of different joint issues. The adjustments I do in the clinic are hands-on, traditional type of chiropractic adjustments, but I also use table adjustments. I use instruments like the activator and the integrator, and I use traction like the Y-strap decompression. So all of these modalities work very well to help joints in the body so that they can heal and function properly. During the course of this webinar today, feel free to ask questions. I'll be checking the chat. There's a few different things going on here. I actually have 3 monitors. You're in my central monitor right here, but I have one to the right. Just being able to stream YouTube on the right side, and I will check the chat while I'm doing this on my monitor on the right. On the left, I have the presentation. So if you see me looking side to side, it's just because I'm monitoring the activity, looking for questions. If you have any, feel free to ask them. In particular today, questions on joint pain and arthritis. So I'm going to switch over now to some specific pain and arthritis. So the foods you're eating, like protein, is very important to improve joint health. Joints have a lot of connective tissue in them. They need to repair themselves, especially if you have damage to the joints or an arthritic condition. And eating foods that are more natural, foods that are low on the inflammatory scale, foods like fish, excellent, eggs, lean meats, nuts, all very important for health, getting enough protein, getting enough fats in our system. So I would say protein and healthy fat are very important concepts to give joints better nutrition, and they do help with losing some weight and getting in better shape, because our body prioritizes protein as an important food source, and we need it for building blocks for the body. And fat is very important for joint health, but it's also important for hormone production, neurotransmitters in the brain, the nerves, very important. Carbs and sugar, not as important. And I think over the last few decades, carbs and sugars have been overemphasized by food producers, by the food pyramid, and too many people are eating too much sugar and carbs. Now, a carbohydrate is a complex unit of sugar. So carbohydrates are packaged sugars in complex molecules, and our bodies can break down most carbohydrates into sugar, and then that spikes the insulin in the body, because insulin is used to take sugar out of the bloodstream and put it into the cells. So what happens is when we get too much sugar at once in our bloodstream, it really affects our insulin levels. It can be pro-inflammatory, and it can affect joint health, because if you have more inflammation in your body, you can get more swelling, and that's the definition of arthritis, is inflammation of joints. So not only is lowering sugars and carbs for most people important, but it's going to help not just with joint health, but with weight loss as well. Now, we won't have enough time to get into everything today, but just suffice to say that there's too much sugar in our diets. Sugar is necessary, and carbohydrates for energy production. So the brain loves it. And when you do eat sugar, the brain kind of lights up with dopamine and serotonin. So dopamine gets released, kind of a neurotransmitter in the brain, and it feels good. So it kind of makes you feel good when you eat sugar for a short period of time. It's much like maybe a drug that someone would take on the street, very similar or very close to the sugar center in the brain. And when that area gets lit up, it feels good, but you do get some cravings then. And it's kind of an easy way to get energy. In fact, it's a little too easy. Your body doesn't have to do much to break it down. And when you get that sugar high in your system, then the body has to figure out what to do with it. And often when you get too much sugar at once, let's say you're eating something very sweet, the body will take that sugar, package it, and put it away as fat. It's going to deposit that energy for later use. So if that continues to happen over and over and over again, you're going to gain weight, and that's not going to be good for your joints, because the joints will break down over time if there's too much weight on them. That, in combination with misalignments in the body and poor posture, can accelerate the degeneration or degenerative effects on the joints. So we want to treat people with chiropractic care to improve their alignment and their posture and their joint health. But we also want to make sure they're making lifestyle changes to take the pressure off the joints and provide good nutrition so the joints can heal properly. So I talk a lot about that in the book, Joint Journey, and I know everybody's different, and there's very specific conditions, very unique situations for each individual patient. So it's not a blanket statement, but when I see people here in the clinic, I get their history, do an examination, and then have a treatment plan that's unique for each person. Now, to change the way that you're eating and to incorporate new habits, you have to make small changes. And I read a book a couple of years ago called Tiny Habits by B.J. Fogg. And in the book, B.J. Fogg, who was a Stanford professor, talked about how habits are formed. And he said you have to change a small habit by doing something new and anchoring it to something old. So, for example, breakfast. If you want to start exercising more, you want to do it before or after breakfast, because breakfast is something you do on a daily basis, let's say, and it's a major habit, and you want to attach a tiny habit to a major habit because it reminds you to do it. So you want to exercise before breakfast, let's say, or you want to exercise right after breakfast. And it's a very good book. I'd highly recommend getting it. It's on Amazon. My book, Joint Journey, is on Amazon as well, but Tiny Habits is really good for making healthy lifestyle changes. Now I'm just going to switch slides here. I just want to make sure that, okay, now extra weight and uneven weight causes, it's easier to get back on track and stay on track. All right, so I'm just going to switch slides. I'm going to go back to my original slide here. So if you're interested in joining me for a workshop, this will be starting in January 2024, and I will be doing regular workshops, and you can join them by signing up on Eventbrite or in our clinic, and you can do them one at a time. So there'll be a fee for the workshops and the webinars, and you can just get a ticket on Eventbrite, or we're going to have a membership or a pass where you will get the extra service, weekly or monthly membership, where you can get webinars like this, where you can get emailed new research, tips on diet and nutrition, exercise, tips on healthy weight. So all of that will be part of that membership service. So right now we're just, we've got a waiting list, but if you're interested in that, please let me know. I'd be happy to put you on the waiting list. And then once we launch that, then you can join us for those special events. If you want to contact us, you can go to our website, tutstreetfamilychiropractic.com/joint journey, and you'll see the different services that are offered there, as well as some links. So go to the website and put in the extension joint journey, the name of the book, /joint journey, and then you're going to see the landing page that has those links in it. Our phone number here, 250-486-0062. You can call or message us here, and we'd be happy to respond. Usually we're pretty quick with responding to messages, so if you have any questions, feel free to text or call and leave a message, and we'd be happy to get back to you. I want to thank you for joining me for today's webinar. I wanted to start touching on some of the concepts in the book, which I did today. The free webinars, I'll continue to just touch on these subjects so that you have a better understanding of what it takes to get healthier, to have better joint health. And I'll be doing that at the free webinars every second week right now on Eventbrite and here on YouTube. But if you're interested in more knowledge, you want to dig a little bit deeper, then join me at the paid webinars and the workshops coming up, and they'll be roughly every second week as well right now. So I'm just going to show you the next webinar. Let me see if I can just switch over here to my webinar slide. So give me a sec while I switch over and I'll pop back. I'll pop back on screen for you. So far, so good. The technology's worked pretty well today. Didn't have any major glitches or major problems. Let's see now if I can just get that one window up for you guys on next week's webinar. Okay, I think I got it. Yeah, here we are. Okay, I'm going to put the slide back up for you guys. Just bear with me. Here we go. So next week, the webinar is going to be one of the paid webinars in our series, and it's going to be how to set and achieve SMART goals for your joint health and weight loss. And SMART goals, that's one of the things that I talk about in the book. The psychologist, Dr. Smart, talks about how Josh and Susan should set SMART goals. And here, there's a page in the book that's dedicated to SMART goals. I don't know if you can see that. And it talks about what SMART goals are. And then there's a template on the next page where you can actually photocopy this or write in the book and make your own SMART goals. So we're going to talk about SMART goals next week, and that stands for specific, measurable, achievable, relevant, and time-bound goals. That's the acronym. And we're going to talk about how you can set SMART goals, and I'll use this as a tool for next week. But really what we want to do is start to focus on what exactly you can do to improve your joint health and your weight in 2024. So I'll use some examples of setting SMART goals. I'll talk about different goals for different people, as I'll use some examples. But also, if you're somebody who's joining us, I'll give you an opportunity to type in the chat and answer your specific questions at this webinar next week. So to get a ticket, you just go to Eventbrite. I'll put a link in the show notes today. Click on Get Tickets. And then once you get a ticket on Eventbrite, then you can use that ticket. It'll have a link to get into this, the webinar next week, and it'll be a private event just for ticket holders. And if you're in the Kelowna area, or if you're a patient of mine, feel free to ask me, because I'll have tickets available in the clinic, and you can join me for this specific event on how to set SMART goals for 2024. So thank you for joining me today. I hope you learned something from this webinar. If you have any questions, feel free to go grab the book. And it is on Amazon right now. The audiobook just got released today, I think it is. It was accepted or approved 3 days ago. So there's the paperback version, there's the ebook version, there is now the audiobook version, and there's a hardcover this time too. And I ordered one hardcover for myself for the clinic. And so there's different versions. The font size in the book is a little bit bigger than normal. I made it 13 points versus 12 because it's a little easier to read. And so I kind of like it because no matter what your eyesight's like, you can read the book easily. There's color graphics, which isn't that common in a book, but I wanted to make them color to make the images attractive. There's a number of yoga stretches in the book, as well as recommendations for posture, diet, nutrition. There's even recipes in the book too. So to get the book, I'll leave a link below in the show notes. And I hope you guys can join me a week tomorrow, Saturday, for the SMART Goals webinar. And then in 2 weeks, I'll do a free webinar again like this, where you can join me just to understand the concepts in the book and what you need to do for better joint health. Thanks again for